All right, so have you ever got down to that submit button, press submit, and just wasn't 100% sure with the submissions that you made for your open enrollment? Then we have a special treat for you. Welcome to TRS Talks, our live stream series that was built for you, our TRS members, to make sure that you're making the best decisions during open enrollment and beyond. And we know that retirement planning is more than just your pension benefit. It's that financial piece, it's the healthcare and other things. So we have special guests that we're going to bring in to make sure that you have the information that you need from the right sources. Now, this will be recorded so you can go back. So we're not taking any questions today, but we have curated common questions from our members. So make sure that you have liked and subscribed to make sure that you're getting notifications about our future events. So with us today, we have Mr. Louis Amos, the Executive Director of the State Health Benefit Plan, or the SHBP for short. In his role, he is responsible for managing the State Health Benefit Plan, or SHBP, with over 670,000 members and an annual spend of $3.8 billion. He is a nationally recognized speaker on the development and implementation of on-site wellness centers and has helped public sector entities on benefit and wellness plan designs. He is dedicated to public service and helping people live their best lives. Mr. Amos, thank you for joining us today. Thank you for joining us again to make sure that we have the right information for our members and your participants.
Thank you so much for having me, and on behalf of Commissioner Carlson, the DCH Commissioner, the DCH leadership team, and SHBP, we just want to say thank you, and to all of the teachers, both active and retired, for all the service that you've done and all the service you continue to do. Your work is very important, and we just want to make sure that you know that you're fully appreciated.
Absolutely. Right back at you. Yeah. All right. So how about we get right into it?
Okay, fantastic.
Okay, excellent. So could you tell us a little bit about how you got into your role at the State Health Benefit Plan?
Sure. I was previously with the State Health Benefit Plan from 2000 to 2005 as a vendor manager. Prior to that time, I had experiences on the payer side. I've worked for Prudential Health, Cigna, and United Healthcare. In between my stints, my previous stint here at SHBP, I was at the city for approximately 15 years as the benefit director over both health and pension. So I have a clear understanding that two things, especially for our retirees, that's important to you, as your pension check and your health insurance. So clearly understand that. But I've been back since 2021 and happy to be in the role I am. As you indicated, the State Health Benefit Plan is probably one of the third or fourth largest public sector plan in the country with the spend. And if you look at it on the private sector, we're probably in the top 10. So it is a monumental task, as you can imagine, but we're committed. We're public service, and this is what we do, and we want to try to make people's lives as best and living their best life as much as possible.
Oh, yeah, absolutely. So your impact and your leadership can be seen across the state with our communications and outreach team. We're out and about, and we see your folks out there as well. So can you speak to some of those outreach initiatives that you have and some campaigns that you have going on?
Yeah, sure. One of the things, as you can imagine, when the pandemic, we weren't able to get out and have meetings with both our active employees and then the retirees. We've kind of reinstituted that. I mean, we're doing open enrollment meetings. For example, for this current open enrollment and retiree option change period, we have about 13 or so retiree option change periods that's specifically for our retirees, and about 12 meetings for the active benefit fairs that are throughout the state. In addition to that, we do have some webinars, and we're at various conferences, whether or not it is the Georgia State Retired Employees, Georgia Retired Educators, Georgia Council of Human Resources. All of the state conferences, the big conferences, we're there. And our goal is just to be able to meet people where they are and to make sure that they have the information that they need to kind of make the decisions that's going to be beneficial for them and their families.
Absolutely, yeah. And you have to meet people where they are with such a varied audience. Yes, indeed. So speaking of that, you have a lot of resources. Can you speak to some of those resources that plan participants should be aware of?
Yeah, clearly, plan participants, from an SHB perspective, they have access to SHBP, and that's primarily through ADP. That's our benefit and eligibility administrators. So they're the front lines in terms of enrollment issues as it relates to eligibility and that nature. In addition to that, obviously our carriers, Anthem, Blue Cross Blue Shield, Kaiser, United Healthcare, CVS, and Shared Care. Basically, they have customer service capabilities and are able to respond and answer any questions that any of our participants may have.
Gotcha. Okay. All right, that's good info. So as far as this upcoming open enrollment, what plan changes or premium changes should members be aware of for 2025?
Great question. So for the active enrolled employees, basically there are no plan changes. So the plan designs are remaining the same. No increase in office visit copays, deductibles, anything of that nature. All of the vendors are still the same. Anthem still offering the same products that they have, the HMO and the HRA. United Healthcare has an HMO and a high deductible health plan. Kaiser has a regional HMO plan. And then for our pharmacy benefit manager, CVS Caremark is still in place, and then Shared Care is our wellness vendor. So there are no changes. The only change is there is a slight increase in terms of premiums. What members will see is about, on an average, about a 6% increase. And when you look at 6%, people better understand when you talk about dollars. So you're really talking about $4 or so for an individual plan and up to about $25, $28 for a family. I do want to point out that the premiums for SHBP, if you look at the last 10 years, the average, we're looking at about an average increase of about 1.4%. Nationally, as you know, healthcare expenses are running about 8, sometimes 10%. So we're below national average. And when you look at what we're offering based on what's out there, both public and private, it is probably one of the best benefit plans that's available.
Absolutely, and I agree. My family uses it. We look at the explanation of benefits whenever we go to the hospital, and what we pay versus what the plan pays pales in comparison. So we are very grateful for the options that we have. Now, when I first started working, my approach to picking my premium or my health plan was to pick the cheapest one I could find. No matter what it offered, I just went with that. And that might not be the best way to go about it. So what would be an approach that members could take for selecting the right health plan for their family?
I think clearly what members need to understand is that you really need to make benefit selections based on your own individual needs. Where the high deductible health plan is the lowest plan from a cost perspective. But there are parameters with that in terms of high out-of-pocket expenses, those high deductibles. Whereas some of the other plans, the HRA plans, the bronze, the gold, and the silver plans, where it may be a little bit more expensive, but the deductibles, depending on personal decision, the deductibles and the copays will vary based on that. And then you have the HMO options. So what I really encourage folks to do is look at, and not just make a decision just based on a financial decision. You have to make decisions that's based on what's going to be in your best interest. Because as you know, I mean, life changes, things happen. And, if you're in a scenario where if you can't financially cover some of those deductibles, people have a tendency, well, do I pay the deductible or do I try to cover other household expenses? Those are the kind of decisions you have to make. And the most important thing is making a decision and having health care. That's the most important thing, because nobody needs to be out here without health care, because we all want an accident away from being in a real horrible financial situation if we don't have coverage.
That's true. That's absolutely true. Yeah, and just thinking about planning for the future, actors will someday be retirees, and depending on where they are as far as when they started work, they might fall into different subsidy policies. So can you speak to how the subsidy policies work?
Yeah, so there are basically two categories in terms of the subsidy. There's a basic subsidy, And that's for anyone who had 5 years of service as of 2012, or if they was in a retirement status. So they're in what's called the basic subsidy plan. The annuity years of service plan, if you didn't fall in that category, then you're basically in the annuity years of service, and then the subsidy is based on the total number of years.
Gotcha.
So the premiums are a little bit higher because the subsidy is not quite as great. So typically, just to kind of give an example, for 10 years, the subsidy is about 15%. If you got 30 years of service, the subsidy is 75%. So that's the biggest difference, and I think a lot of people, kind of don't understand, but it's important, especially when you get into that retirement status, when your income is somewhat changing, but the health premiums are, in essence, not what they were probably when you were in an active status.
Okay, that makes sense. So kind of like our pension, the longer you work, then the greater that benefit is for you.
Exactly.
Okay, that makes a lot of sense. All right, so life changes, as you mentioned. Can you speak to the importance of contacting the state health benefit plan when there's a qualifying event, and what are some of those qualifying events?
Yeah, a qualifying event will be marriage, divorce, adoption, things of that nature. And birth. One of the things you want to do is make sure that you notify the state health benefit plan within 31 days of the event. So, I mean, that's just kind of a standard process that's probably throughout the industry, is that you have to have about 31 days to notify. But if some of those things happen, you want to make sure, if you want to add dependents or add spouses or whatever, or even want to drop people off the coverage, that you take advantage of that period, which is, that 31-day period.
31-day period, okay. Okay, so this is a reminder to our TRS folks. You want to make sure that if you have a qualifying event, that you log into your TRS account as well and update your beneficiaries with us, because updating it with state health benefit plan or your other benefits, your flexible benefits, that does not roll over to TRS. So make sure that you're doing that. And again, if you haven't liked and subscribed, make sure you've done that as well. Now, continuing with our questions, for those that plan to work until they retire and then start collecting the benefit, they're enrolled in state health benefit plan. Is there any need to reach out to you all if they're going right into retirement from their employer?
So basically what happens, the process works probably best if they're going to be terminating as a result of retirement, is that make sure that they notify the state health benefit plan, and they are able to continue with the coverage in a pending status until approximately about six months or so. So they have until that time frame. But obviously they will be responsible for the premiums, but they're in a retired status, but in a pending status in terms of being able to finally get into full retirement and have benefits as a retiree.
Gotcha. Okay. All right, that makes sense. Now, this is a situation, it's kind of in the same vein with that. That happens. So a member decides to retire at the last minute. Sometimes people walk in that day and they say, you know what, this is the day. I'm out of here. And it's at the end of the school year, but it takes some time for us to process the retirement, 6 to 8 weeks on average for us to process the retirement. But the member is off their employer's payroll and may have a gap in between the time that they're on the TRS payroll. So if that's the case, what do members need to do if they're kind of in that limbo, and just to make sure that their health insurance is intact?
Yeah, in order to maintain coverage in retirement status from active to retirees, you can't really have a gap in coverage. So there are basically two ways in terms of if there is a gap, if there's a need to have a bridge. One is through COBRA. And COBRA is a little bit expensive. Let's be honest with you. You have both. You're paying both the employee and employer, and I think a 2% admin cost. So it is a little bit expensive. But for some folks who have at least 8 years of service, they can do what's called the state extended coverage. So they are able to pay. Will have to set up a direct payment, but it gives you that coverage gap until you reach the normal retirement age in terms of 60 and moving forward from that.
I got you. So it sounds like just retiring at the last minute might not be.
Yeah, I mean, you got to plan. Like anything else, you got to plan. It's important that you plan.
Yes, sir. That can be expensive. It sounds like.
Yes,
So
yes,
plan out your retirement. Okay, I got you. All right. So let's say somebody is 59 years old and stops working. So they've terminated with the employer, and then they're going to start drawing their retirement at age 60. Would those same options?
Yeah, those are the options primarily that are available. The COBRA and the state extended coverage plan. But you still will have to do a direct pay in that regard. So,
okay.
Yep.
Okay, that makes sense. And then when they turn 60, are they back in the group plan or?
Well, you'll continue. It'll be in a retiree status versus kind of in that active pending status.
Gotcha.
Right.
Okay, so that's definitely a benefit. All right, now let's say sometimes we have people that stop working when they're age 50. And let's say they go under that state extended coverage for a while, but they've exhausted that. Do they have any options at that point?
Well, I think it probably go with COBRA, but that remember COBRA is only 18 months, so you have to make a calculation in terms of the time, the pending time, and the time in which you're going to go into retirement status. So that's why I say it's always good to plan and know what options are available, because the last thing you want to do is get into a scenario where you think you have coverage and you basically have a gap in coverage, and you're not able to continue with your coverage.
Oh yeah, absolutely. Okay. Now, we have members that are beyond 60 and they continue to work, and then they are approaching age 65 while they're still working. So is there anything significant that they need to do as far as their health insurance is concerned?
No, as long as you're actively still working at 65, you don't have to go on to a Medicare Advantage plan. One, because you're still contributing to Social Security, Medicare. The only time that you have to go into the Medicare Advantage post 65 is when you're in a full retirement status.
Okay.
So people are working longer and they're continuing on an active plan, it's fine. But once they are going into a retirement status, then obviously they need to follow the protocols in terms of the 30-day notification to make sure that we can make that transition a seamless process.
Okay.
But if you're actively working still at 65, you don't have to make any decisions. It's just when you're going to go into a retired status.
Gotcha.
And that's for the active employees. Now, if there's a spouse, those spouses will need to definitely notify us and, obviously take whatever steps it needs to enroll in the Medicare Advantage plan. So the spouse is a little bit different. Active employees can continue, but the spouse will need to go and enroll in Medicare Advantage through Social Security and get the Part B.
Okay. All right. Yeah, that was a good tidbit right there. All right. So let's switch over to retiree questions now. So for those that are approaching age 65 and then they're retired already now, do they have to make any specific decisions at that point?
Yeah. So at age 65, if you're in a full retirement status, you basically, in order to receive the state subsidy, you have to go into one of the Medicare Advantage plans. So the state currently, we have two Medicare Advantage plans, the Anthem Medicare Advantage and United Healthcare Medicare Advantage. So those are the two. But you have to go get Part B, because the way Medicare works at 62, you automatically are eligible for Part A, and that's free. Okay. All right? So at 65, you have to go and get Part B, and that's done through Social Security. So the way the payment takes place is here. If you're getting Part B, the Part B premiums are taken out of the Social Security check if you're eligible for Social Security, or if you're not, then it's through a pre-bill process. The premiums for the insurance is taken through the retirement check in terms of that's how that's done. So Part B, you got to get it if you're in a retired status, and that's done through Social Security. So you'll have to pay Part B and the premiums for the state health benefit plan, so that folks know you just can't pay one and not pay the other.
Gotcha. Okay, so some coordination.
Yeah, exactly.
That needs to go on. All right. So that's really good information for our folks. All right. So speaking of that Medicare Advantage, are there any changes coming up for this open enrollment in 2025?
Yes, there are significant changes for those who are in the Medicare Advantage. Let me just kind of take a few minutes to kind of explain that whole process. For open enrollment for retirees, those retirees that are pre-65 that are in the commercial plans, basically they don't have to do anything. If they're satisfied with whatever options that they have, it will basically roll over. But for the Medicare Advantage folks, the state, we're required by state regulatory to do procurement for our contracts. The Medicare Advantage contracts that are currently in place hadn't been procured for about a 10-year period, so we were behind. So we had to go through a procurement process. We did that in the first part of the year, and as a result of that procurement process, basically the two incumbents, Anthem and United Healthcare, were selected. The difference here is, there are a couple things here. One is, as a result of that procurement, CMS, Centers for Medicare, Medicaid Services, basically says you can't just default. So you have to give people the option to make a decision. So under this current enrollment process, the retiree option change period, active Medicare Advantage participants will need to make a decision, right, to determine whether or not they want to go with United or if they want to go with Anthem. If they don't make a decision, they will automatically then be defaulted into the lowest cost plan. So let's kind of go through that a little bit. Anthem, unlike previous years, will be in 2025 will be the lowest cost plan, okay, in terms of the standard plan. So what happens if somebody just fails to not make a selection? They will default it into the Anthem standard plan. Now the premiums were determined by the carriers. As I indicated, we went through a procurement process. We asked them to give us the best and final offer. There were two recommendations. One was best and final offer, and not to change plan designs. So plan designs are not changing. So what's covered currently will be covered in 2025. The significance of that is that you don't have to go and change doctors. Whatever was covered under United, which is majority of the folks are currently in 2024, will be covered with Anthem, vice versa. So that's one thing I think make sure everybody understands, that the plan designs are the same. But obviously one of the biggest concerns is the cost. Whereas United was at a zero premium, that premium has now increased to about $82, and that's, once again, a business decision that they said it would cost for them to provide services. Same plan design, and not to make any major changes. And Anthem, on the other hand, from a business perspective, they basically indicated that they could do it, and the lowest cost standard plan would be $20. All right? Same plan, same design. Our members do have a choice. Let me just make sure they have a choice. If they want to stay with United, they can. If they want to go to Anthem, they can. So same benefit plan design, choice is theirs, but nobody will lose coverage. That's the main thing, is that nobody will lose coverage. And obviously, they will get a confirmation of coverage statement in December. It'll tell them what you're going to have for 2025. And then they have an option then to say, well, no, I don't want to do that. No, I may want to go back to this plan or that plan. But the options are there. And from the standpoint, if you look at, the premiums for the last 4 years, we've had a zero premium. And it's difficult. I mean, let's just be honest in today's time, because CMS, Centers for Medicaid Services, are making significant changes. And regardless to whether or not you're in a Medicare-only plan, an individual Medicare Advantage plan, or a group plan, you're going to be impacted by changes. The Inflation Reduction Act and some of the other things that's going on. But the good news, there are two good news that I really want to share. One is that our Medicare Advantage plan is a PPO plan, which means that you have the ability to go to doctors in network or out of network. So that's a big difference when you look at some of these other individual plans. They are more of an HMO, all right? The other thing, you often hear about issues about hospitals and these payers having these contract disputes. Our members aren't really subject to that because, once again, as long as the provider accepts Medicare, then basically they can go in network or out of network. They'll be paid the same, benefits are the same. And the significance of that is that especially you hear some of these hospital systems and some of these carriers having a contract dispute and they're terminating agreements. And it's a real concern, as you can imagine. Case in point, in the Atlanta area, United and North Georgia health systems have been in this contract negotiation period for about 6 or 8 months. And those members who are in the Medicare Advantage plan that use those facilities have been able to continue to get care. So, I mean, it's important. We know that healthcare is important, and it's complex. The other thing I do want to add here is that there is one benefit that Medicare Advantage folks will see in 2025. That is a $2,000 out-of-pocket max for pharmacy. Significance of that is that if you have multiple prescriptions, once you meet a certain threshold, that's equate to about $2,000, then everything for the remainder of the year is free. So for those who are on some of these high-cost specialty medications, I know you may be paying $80 whatever dollars, but that cost of that medication, once it reaches that $2,000 threshold, then the remainder of the year, you're at zero. So I mean, that's as you can imagine, it's significant because it went from 8,000 to 2,000. Wow. So there are some, it's some positives, when you look at it, but we know that it's a change. But hopefully that our members will still get the best care that's available.
Yeah, and it sounds like it. So from what I'm hearing is make sure you check your mail.
Yeah,
right?
yeah, that's it.
But even if you don't, for whatever reason, you still will have some form of coverage.
Yeah, coverage. Nobody's going to lose coverage, and it's important. I mean, you can imagine come January 1st, if you have a medical condition and you show up and they tell you that you don't have coverage, because these people, most folks have worked, especially retirees, 20, 30, 40 years have this benefit. Mm-hmm. And we want to make sure that they will continue the benefit. So
that's right. Yeah. Speaking of people working for a very long time, some of our retirees come back to work. Mm-hmm. So we have House Bill 385, mm-hmm. which allows our retirees to come back in the classroom full time in certain special areas. In that case, can they keep their insurance if they come back under the House Bill 385?
Yeah, so the way it's set up, that they're able to get the monthly annuity plus an active paycheck. The benefits will be considered as a part of the annuity. So they can continue the deductions that they have that's in place as a retiree will continue to allow them to keep that benefit, and they're able to continue coverage from that perspective. And quite naturally, it's a little bit cheaper, so it's more beneficial for I would think that you would want to stay with a retiree cost versus what mm-hmm. some of the active costs are.
That's true. Yeah, that makes sense. Okay. All right. Now, if somebody is returning to work, mm-hmm. How do they ensure, just make sure that everything is in place? So what we have some people do sometimes is they'll go back to work mm-hmm. and retire, and then go back to work again mm-hmm. and retire. Mm-hmm. When that happens, do they need to reach out to you all in those cases, or is there any automation with that sort of process? So
kind of the first retirement is kind of a seamless process because we work with you guys in terms of making sure that they have the benefit coverage and that whatever benefit selections is in place. If there's a second retirement, then that is going to be on the participant to kind of let us know within 30 days of that event, because that's kind of considered a life event. And it's not like, unlike the first retirement that you go through, because a couple things have to happen. One is, you guys have to know in terms of deductions, in terms of things, of that nature, in terms of how the benefits are taken out.
Gotcha. Okay. All right. That makes sense. All right. Now, let's say if somebody is retired and for some reason they discontinue the insurance. They reach out to y'all and they say, we don't want our insurance anymore. But then down the road, they realize, oh man, I had a really good insurance option or plan. Can they get back in the plan any type of way?
The only way, in all honesty, is that they would have to go back into a benefit earning position in order to be eligible. Because once you leave, you can't come back. So, if they go into accept a job that's in a benefit eligible, then obviously the clock starts all over again.
Gotcha. Okay. All right. So what I'm hearing again is make sure you got to make sure your coverage is continuous.
Right. Yeah. Because again, no breaking coverage.
All right. So whether that's working, retired, and if you have that break, and you get rid of your insurance, you got to come back to work in order
to be eligible. You got it. Yes. Of course.
I got you. Okay. All right. So y'all hear that? Y'all hear that, folks? If you discontinue your health care coverage in your retirement, then you got to come back to work full time. So that's something to keep in mind. All right. Now here's some questions for our employers, and they are TRS members. They get their retirement, but they're handling the administrative side of this. When those members come back to work, should the school system or the retirement system, and you kind of answered this already, deduct those premiums if the member is employed full time?
Yeah, I mean, basically, the school system should basically report that they're in a retired status and not in an active benefit earning status, and then they will be able to continue the deductions out of that retirement check.
Gotcha. Okay. All right. Now, are there any employment types where the employer would be responsible for handling that side of it? So, like outside of House Bill 385, let's say if they came back to work part-time, or if they are doing like contractual work, but they're collecting their retirement check.
They have to be in a benefit earning. I mean, outside of the House bill, they have to be in a benefit earning position in order to be eligible for benefits.
Gotcha. All right, so that's quite clear. All right, now switching back to the active members, how can TRS covered employers help their members during the open enrollment process? So, the members will come to them and ask them about TRS stuff and Social Security and all these other things. What are some things that they can do to help you all and help the members during open enrollment?
Well, one is just to make sure that the members make sure they got correct addresses. Make sure that they have somewhat of an understanding of the plans that they're enrolling in, and that the open enrollment process, once you make the decision, that it's for the next 12 months. And then more importantly, just, here's the one thing that I would say, especially for our active members, is to make sure you encourage them to use the benefits. One of the things that we're seeing is that, while people may have benefits, they don't have relationships with a primary care physician. So it's important because it helps us all. Case in point, we just recently installed an on-med. It's kind of a health station there at the towers, and they saw probably 200 or so folks in the last week or two, and 45% of the folks didn't have a relationship with a primary care physician.
Wow.
So it's, I mean, it's a benefit. I mean, you look at all of the preventive care that's available, that, trust me, an ounce of prevention saves you a long time. And given we're here in the South, we're, in terms of we're in the stroke belt, obesity, hypertension, diabetes, and all of those things in terms of what it's doing and how it's impacting even as our younger family members. And I think it's just working collaboratively with us to make sure that people are at least, going to get an annual exam. Because that's an opportunity. I mean, you could, on those HRA plans, you have an opportunity to get $150, $480 credits. Kaiser, your family can get up to $1,000. It's $500 for a subscriber, $500 for their spouse. So, I mean, and it's just, I think it's incumbent upon us to get more involved in the healthcare decision-making process. While, a lot of times we don't want to know, but it's important. I mean, when you catch things at an early point, then, you're able to be treated and able to manage. And, obviously you live longer.
Yeah. Oh, yeah. And you shared a great story during the podcast that you had with us about preventative medicine, and catching things early. So I highly recommend that members check that out. That's a great testimony that you have about that. Yes, sir. Yes, indeed. All right. Just a few more questions. We're gonna wrap it up here. So we're in an open enrollment period. Do members need to do open enrollment every single year? Sometimes people say, well, I don't have time, I don't feel like it. Do they need to do that every single year?
Well, I encourage folks, you always want to look and check and see what you got. I mean, even if you don't really utilize it, I mean, you're paying a premium, and you just want to see what that premium is.
Yeah.
And more importantly, I think, the whole healthcare decision-making process is something that we're working to try to improve. because we need to get our folks out and get people to at least go to the doctor. Get for like females get the mammograms. The males prostate. Colon cancer. These screenings, all this stuff is free. It's a part of the preventive coverage. So to me, there's no reason why folks shouldn't, one, check, see what you have, and if there is a need to use healthcare, at least have your card or have an idea of what you have. You'd be surprised. You go to some of these benefit fairs and you ask folks, well, what plan you have? And people, some they just don't know, and that's just, that's not acceptable. You get an ID card. If you lose it, you can always get another one, but at least know what you have, because you just never know in terms of when you'll need it, and then it helps that whole process in order for you to kind of get services that are needed.
Yes, indeed. Yes, indeed. Okay. Now, this is on the preventative side. We're talking about preventative with health, but unfortunately, scams are out there. We see a lot of them with the pension plan, and just finance. There's data breaches left and right. So, have you seen any scams as far as healthcare is concerned, and are there any that people should be on the lookout for?
No, not necessarily scams. I just want to kind of reiterate to our retirees, the Medicare open enrollment period starts, I think, October 7th or so through December. And Joe Namath, Joe Montana, William Shatner, J.J. Walker, those folks are going to be calling them. And, they're going to be trying to basically tell them, hey, if you come to our plan, it's the best thing almost since sliced bread. But the reality is those plans aren't comparable in terms of what they're getting with SHBP. You look at it from the standpoint of specialty visits, the standpoint of, some of those are HMO networks. You don't have the similar type of network that you have in terms of a PPO like. The pharmacy coverage, it's about 60% of, we have an open formulary, they cover probably 6%. But more importantly is that, once you make that decision to leave, you can't come back. And once I know about as well as anybody else, is that folks who work 25, 30, and 40 years for a benefit, I would hate to see them lose it. Because, I could give you a case in point. A couple of years ago, there were about 700 to 800 folks who were with United, and we kind of worked with United in terms of, they do this process of when people are terminating and leaving. So of that 700, probably about 550, close to 600 folks said, we didn't mean to.
Wow.
You know what I mean?
Wow.
And we were able to help them. But you can imagine for those who were not able to help, and you enroll in these plans, and it's just, as I go into these meetings with the retirees, I basically say, please, ma'am, please, sir, hang the phone up, because it's not. It sounds good, but it's just not. It's not a good benefit for you. And people have. Let me just say this: they have choices,
right?
But these are kind of choices that you make can be real severe if you're losing a benefit that you've worked and that you've earned. So I just make sure they're aware of it, because they get postcards. They get calls. It's funny. My in-laws are covered on the SHBP, and they say they start getting calls from 8 o'clock in the morning, sometime 8, 9 o'clock at night. So and you can imagine, if somebody is an elderly person and they, you talk to them, and sometimes they're automatically slamming people over because they say you agreed to do this. And that's just, we really are concerned with that. Yeah. And it's important that people understand, don't make those decisions. And that's, but they do a great job, I had to say, but it's detrimental.
Wow.
Yeah.
Wow, that could be a costly mistake.
Yeah, right? All the time, yeah.
Yeah, and I'm sure it sounds good. We've seen some of the things out there as well,
right.
And wow, ooh, that's tough. Okay, that's really good info. Now, do people at State Health ever reach out directly to a plan participant, say by the phone? So is there ever a time where they should pick up the phone and it's you all?
No, it's the only time that you'll probably have some outreach, as I indicated earlier, as a part of our outreach for those Medicare Advantage participants that are aging in, ADP will send notifications out 4 months and 2 months. And that's just to say, hey, you need to make sure that you get your Medicare Part B card, need to provide that information. But that's about the only time, unless somebody is dealing with an individual situation. But just as a general rule of thumb, no, we don't. It's not a need to really, send information, because we coordinate through ERS and TRS. You know what I'm saying? Because for most folks, so if you can see, there's a correlation. So there's really not a need for us to reach out. But from time to time, if people are trying to enroll in some of the Medicare Advantage plans, things of that nature, that ADP will do an outreach, because that's more of a help, but not to get personal information.
Gotcha. Okay, so Mr. Amos is not calling any members directly to enroll.
No, we won't do that.
I got you. Okay. No. Yeah, that's good. And I think sometimes people might think that that is you all, and it's not reaching out for personal information. Well, you have shared a wealth of information that is really going to benefit our members. But are there any last words that you want to leave with the audience before we wrap this up?
Yeah, I just want to make sure that as a consumer, that we take full advantage of what we have available. The benefit coverages that are offered on the State Health Benefit Plan are probably, I'll say that, I guess, because I'm the champion for it, but some of the best in the country. Not only based on cost, but in terms of the services that are available. And when you look at it, at the end of the day, you want access to care, and you want quality care. And that's the thing that we're committed. And obviously, we're working each and every day to try to make that better. But I just want people to understand that, the benefits that's offered by SHBP is clearly top of the line. And I encourage folks to make a comparison in terms of what's offered in other public sector and also private sector. And you see it's a great plan. There are options. People do have choices. But more importantly, we're committed. We're committed to making sure that our participants and their dependents have an opportunity to live the best quality of life.
Yes, indeed. All right. I think that sums it up. Mr. Amos, thank you so much.
Thank you so much
for joining us today. We thank you for the information and your team as well. Please let us know that we appreciate them coordinate this. They do a lot of stuff in the background. And
yes, sir. And kudos to my team. They really work hard. But we're dedicated public servants.
Absolutely.
And we're committed to doing what we need to do for everyone who's covered under the State Health Benefit Plan.
Absolutely. All right. Well, that wraps it up for today, folks. If you haven't already, again, please like and subscribe and make sure that you're joining us for our next session of TRS Talks, which is going to be on October 21st at 4 p.m. with Mr. Luke Atwood, and we're going to be talking about budgeting and financial literacy. But until next time, we hope to see you again. Stay well and stay safe. Thank you.